access of digital health solutions, global challenges and opportunities, distributing an even future. Moderated by Lambert Montevecchi, Boost Consulting, with Julian Molitor, Invenion and FetoLife, and Nina Sesto, Magdalena Clinic for Cardiovascular Medicine, Croatia.
Hello everyone. It's really a great pleasure to present this panel. It's a huge topic. Challenges and opportunities and accessibility to digital health. So in 20 minutes it'll be an incredible task. But I'm very happy to have two great speakers that I've had the chance to meet since yesterday. Both of them have an incredible experience, a very varied experience. Nina Sesto is a biologist and also has an MBA, and she's currently working in a hospital, and she pitched earlier her solution. And Julian Molitor is also German. She is from Croatia, and I'm French, so we have some international people on the floor. And Julian also has been a banker, has been a consultant, also has a foot on the ground in hospitals, and is building as a CEO of 2 startups. So let's get into the topic right away. And I think the intention of the panel was to perhaps compare more developed countries to less developed countries. I don't like that term very much, but some of the differences that we can find around the globe. And let's talk a little bit about those differences. So I will start with asking Julian, from a German perspective, the access and the situation with digital health in Germany.
Yes, thanks so much for the introduction also. So in Germany, the whole system looks like this, that is really decentralized. So in every region, every county, we have more or less a state on its own, and every hospital works on its own. The consequence, every innovation in the digital health area needs a lot of time until it's really spread across the entire system. The same applies to insurance reimbursement. It is really like decentralized. And last but not least, to keep my answer short, also when it comes to the patient, there is a lot of hesitance to accept digital health solutions because people are so used to the existing healthcare system, which means we have specialists all around, really close to where we live. And this telehealth and telemedicine solutions is nothing people immediately accept when they have to basically not meet the doctor in person anymore.
So Nina, what can you tell us about some of your experiences in Africa in particular?
Yeah, so while I did my MBA at Wharton, we did a consultancy project for Dana-Farber Cancer Research Institute. They wanted to know how to accelerate cancer research and treatment in sub-Saharan Africa. So I'm not an expert, but we did spend some time in Senegal and Ghana studying their healthcare systems. And this was back in 2016. But it was amazing how much they were already then focused on implementing digital health technologies, telemedicine technologies, because besides some infrastructural gaps, one of the biggest problems is know-how and access to doctors and specialists. And I remember one, anecdote that in fact they had in Senegal at that time. They had one pathologist reading all the histology slides for all cancer types. So they were building these programs in partnership with the European countries and the US to bring in this know-how, and that can then reinforce basically their healthcare system. And it's amazing, to see how, this greenfield approach, how they can be so much more innovative than in European countries. And I remember a very interesting program that was in Malawi, that also in 2016, where they were using smartphone cameras for diagnosis of cervical cancer. I mean, I thought that was just amazing. And I think really what's the advantage with digital technologies is, you know, if you compare, let's say, to biotech or medtech, you know, for the resources to develop a new drug or a new heart valve, you know, you need this extremely expensive infrastructure. But digital tools are in fact cheap and widely accessible. So, you know, you can be very creative in implementing them in developing countries.
That's really interesting because we've heard a lot of really interesting insights from the different panels. We've not really had the chance, and perhaps some of the speakers who could have attended or should have attended couldn't make it, perhaps because of COVID or visas from faraway countries. I'm thinking of Dr. Monica Sonu, for example, from India. Would have been interesting to hear what she has to say about the deployment of digital technologies in India. But anyway, it does seem as if it's almost easier there, despite the fact that they have less doctors, less infrastructure. But the openness, the eagerness to make that leapfrog progression is there. And there's also probably more creativity on the ground. Not that we don't have enough, but we're old countries, old nations, old continents. So that's really an interesting viewpoint. Let's talk a little bit about the challenges. So I'll start with you, Julian. What can you tell us about the challenges on digital health, perhaps in Germany and in Europe, based on your experience?
So my experience is in general, the approach, I mean, let's say digital health is a really broad topic, but when we think of digital health in a way that it helps us to prevent diseases and do some like outpatient monitoring, it really requires us to change the entire system. Because at the moment, how it looks in Germany, and I assume also in France, mostly we cover treatment. That means the person has to get sick and then recover this reimbursement and whatever. But now we have to start to actually have more a value-based approach and see what sort of prevention can actually reduce the overall cost in the system. And that means all the stakeholders have to work together, and this is in Germany a big problem. So we have to, first of all, politics has to change, more giving regulation more towards prevention. Insurance has to change, understanding that just covering treatment is not the solution and not fostering digital health solutions. And last but not least, also the doctors have to change, because they shouldn't focus anymore on treating people, doing any surgeries, but making sure that the people just don't have to get the surgery. And this is a big problem at the moment.
Thank you. What about you, Nina? Challenges?
I mean, there are quite a few challenges, but I would highlight two. And, you know, going back to Africa, one of the big issues of why many of those telemedicine programs were not sustainable is just because there was a lack of the right business model so that this could sustain. And the fact that doctors are a very expensive resource, and we don't have enough of them. And this is not only case for African continent, but nowhere in the world we have enough doctors. And with the aging population, the rate of the growth of the number of chronic patients is much steeper than how we can educate medical professionals. So it's not enough only to digitize this interaction between patients and the doctor. We need to, this solves this geographical issue so that they don't have to be in the same place anymore. But we need to empower doctors to monitor much larger number of patients, because that's the only way to sustain universally accessible healthcare. And the second challenge is, I mean, what we are now seeing, now speaking from the shoes of clinic, that there are so many digital health solutions out there, and only in the last year there have been more than 90,000 new digital apps on App Store. But the quality is so questionable. Many of them are not even downloaded, not used. And you as a clinician, there is not the right system kind of to evaluate the quality of those apps. And many of them are not even involving medical professionals during the development of the technology. So we kind of, the innovators and researchers are still quite detached from the clinical reality. And what we need to do is kind of bring those worlds together. I mean, they should co-develop. This digital health needs to be co-developed.
And what can you tell us about some of the challenges in Africa that you saw? We said that it could go faster, that their desire to go quicker is definitely an incentive, but what are some of the challenges?
Yeah, I mean, the development doesn't need to be linear, right? Let's say, if we talk about Croatia, for sure, German healthcare system is a lot better organized, so we often look at the other European countries like yours or Sweden, to try to see an example, where should we be in X years? But that's a very linear approach. It doesn't have to be that way. We can leapfrog, we can be a lot more creative. Mm-hmm. And this is what we can learn, let's say, from African initiatives.
Yes, very interesting. Then let's pass on to opportunities, lots of opportunities. We're understanding from our speakers that it really depends where you are, which part of the globe you are. You have to have a good knowledge of the local situation. But Julian, what can you tell us about the opportunities you foresee with digital health, not only in Germany, but around Europe, and based on your experience?
So, I mean, first of all, my perception is digital health solutions improve the care. Like when today and also yesterday we heard about artificial intelligence solutions and all this, and I definitely see the benefits of this. So there's one element. In particular, with respect to Germany, I mean, we have a special situation. Our population is getting older and older, so we have this elderly care problem at some point in time already now. Also, more and more people are moving into the cities, so people on the countryside don't really get the treatment anymore. Hospitals on the countryside don't have the funding to really keep track on this digitization trend. So I would say there's huge opportunity when we use these digital technologies to really bring the good quality of healthcare also to the countryside and also to the old people, because they really need it. And we will not have, for example, the people who can always take care, like physically take care and be on the side with, for example, the old people. So,
bringing healthcare to faraway locations, I don't know how many of you have heard about what, for example, Rwanda is doing with drones. They didn't take long to use drones to deliver vaccines or vaccinations, not necessarily those little drones that we use to make pictures, but bigger drones that can carry more kilos to faraway destinations, which would have taken hours, if not days, by traditional means. So that's just a small example. And then just prior to COVID, early 2020, personally I was in Manila doing an assessment of a healthcare system there. Everybody's got 2 or 3 mobile phones to try to save on the tariffs of the telco companies, but it's one of the most polluted and highly congested cities in the world. So despite all the great technology you have, if you can't take the sick person that has a cardiac arrest or something to the hospital, he's not going to get any attention or any cure. So again, it's just interesting to see on the ground how some of these technologies that we've been talking about over the last 2 days can help situations as different as delivering medication to a faraway village in the middle of the jungle, to just addressing a problem with traffic in the middle of a big city. Opportunities from your point of view, Nina?
Well, I think with this pandemic that we are experiencing, one of the good things that came out is that really this old, I'm allowed to say this, but old-fashioned and change-averse industry in a way that is very, very difficult to change, was shaken. You know, the healthcare systems in developed and developing world were, you know, confronted with something they didn't experience before. And I mean, in our case, we had to, within days, we had to shut down all our outpatient clinics overnight. Boom, gone. And patients are overnight left without any contact with their doctor, without knowing what to do. So in these kind of situations, you know, we were able to launch within a couple of days a virtual clinic, a platform where the patients can send their medical, some medical information. They can book in which time slot they want to speak with the doctor. You know, the whole system was set up in a couple of days. This would never be possible. And it was very well, of course, accepted from the patient side, but also from the doctor's side, who saw all the benefits of, you know, virtual consultation with patients. So then, okay, the pandemic kind of got under the control, and we of course opened our clinic, and now we are back kind of to normal. But this type of service remained because you know, both patients and doctors, they change their behavior, and this is permanent. So, this is just one small example. And we've seen for the past 2 years how the whole industry accelerated. And, you know, in terms of number of in digital health startups and initiatives and investments that are now oriented towards digital health, it's exploding. And I mean, we are now on this wave. It's just fantastic. Yeah.
Hopefully we can ride this wave as long as possible. I've seen some numbers that tend to show that after that incredible increase in teleconsultations, it's going back down, obviously, because we were probably so deprived because of physical lockdowns and being away from our doctors, from our friends, that we now want to go to the hospital. I'm currently working in 2 hospitals where during COVID, of course, telemedicine really boomed, but there is a risk that it'll peak and go back down. But nevertheless, it's been a great opportunity. So for these final seconds, just a word of conclusion from Julian: opportunities, challenges. How do you see the future?
Oh my gosh, in 30 seconds. I think we really have to make sure that we really change the reimbursement system. That will change a lot in terms of digital health solutions.
Nina?
Well, I think these kind of conferences are great opportunities to exchange, and I mean, we all have to think together how these digital health initiatives can become clinical reality as soon as possible.
Thank you very much to both of you.
Thanks to you.